Have you ever wondered how important it is to know the recommendations and warnings before performing oral sex on a woman? As we advance in age, sexual priorities and needs can change, but that doesn't mean sexuality disappears. Mature sexuality has a special beauty, full of wisdom and consciousness. Today, I want to talk to you about a topic that is still taboo for many men, especially those over 50. It's essential to take certain considerations into account before engaging in oral sex with a woman. This content is aimed at people over 50, a group often overlooked in discussions about sexuality. If you're listening to this, you're likely at a stage in life where your body has changed, your relationship with your partner has evolved, and the ways you connect intimately have gained a deeper meaning. Sex isn't just a physical act, it's an emotional and psychological connection, and for many, a way of nurturing the relationship. However, like all intimate practices, oral sex with women requires knowledge and responsibility. One of the first and most important considerations before engaging in oral sex is hygiene. While it may seem obvious, it is necessary to emphasize. Over the years, as a sexologist and doctor, I have seen many men overlook the importance of their own oral hygiene before approaching a woman's genitals. Bacteria in the mouth can cause infections in the vaginal area if not properly managed. The International Medical Practice for Sexology recommends that anyone performing oral sex maintain good oral hygiene. This includes brushing teeth regularly, flossing, and using mouthwash to reduce bacteria. Also, if you have mouth wounds, cuts, or ulcers, it's best to abstain until they heal completely. Small abrasions in the mouth can serve as entry points for pathogens, increasing the risk of infection transmission. Another aspect to consider before performing oral sex is the health of your partner's vagina. The vagina has its own ecosystem, a bacterial flora that protects against infections. Throughout the menstrual cycle, hormone levels vary, affecting vaginal pH and its susceptibility to infections. In the days leading up to and after the menstrual period, the pH of the vagina may be more acidic, which can cause irritation if not approached with care. It's also essential that both partners are in good health, as conditions like diabetes or recurrent urinary tract infections can affect the natural balance of the vaginal flora. A study published in the medical journal of Sexuality emphasizes the importance of openly discussing any discomfort or possible infections with your partner before performing oral sex. This isn't only an act of care, but also respect for the other person. Oral sex is not just about technique, it also involves a deep emotional connection. At 50 or older, sexuality can be enriched by a greater understanding of a partner's emotional needs. According to a study by the Kinsey Institute, men who engage in oral sex with their partners show higher levels of sexual and emotional empathy, which contributes to a stronger relationship and greater well-being in their lives. However, it's crucial to remember that not all women feel comfortable with this practice, and the reasons for this can vary, from past sexual experiences to psychological or self-image issues. Open conversation and respect for the other person's desires are key. Ask, listen, and make sure both are comfortable and willing to enjoy this experience. Although technique matters, communication is paramount. It's not about following a magic formula, but rather being in tune with your partner's responses. As a sexologist, I always advise men to pay attention to a woman's reactions, as her body can communicate much more than words. The clitoris, while a major center of pleasure in women, is extremely sensitive. Direct and constant stimulation can become uncomfortable if not done correctly. Alternating intensity, speed, and pressure is key to maintaining pleasure, but what's just as important is asking. Many men, especially from previous generations, avoid talking about what they're doing in bed, which is a significant mistake. If you're unsure whether your partner is enjoying it, simply ask. Researcher Lori Brotto, in her book on female sexuality, mentions that women who feel comfortable talking about their preferences during sex report higher satisfaction in their relationships. Don't underestimate the power of a conversation. Finally, it is essential to talk about sexually transmitted infections, STIs, in the context of oral sex. Although oral sex is considered lower risk than other forms of sexual activity, it is not without dangers. HPV, herpes, human papillomavirus, syphilis, gonorrhea, and chlamydia are some infections that can be transmitted through oral sex. While these STIs are less common in older adults, they are not impossible to contract. If you have a new partner or are unsure about your partner's sexual health, it is always advisable to use protection, such as a latex dental dam or condoms designed for oral sex. According to the American Medical Association, sexually transmitted infections among older adults have been increasing over the last few decades due to a lack of sex education in this population. This demonstrates that sexuality does not end with youth, nor do the risks associated with it. In summary, practicing oral sex with your partner can be an intimate act that strengthens the emotional and sexual connection between you. However, like any sexual practice, it requires knowledge, responsibility, and communication. Maintain good hygiene, be mindful of your partner's health, and openly discuss what each of you enjoys. Don't be afraid to explore this aspect of intimacy, but do so with respect and the consideration you both deserve. Remember, sexuality and maturity is an opportunity to discover new forms of pleasure and connection. As I always tell my patients, the body may change, but the desire to love and be loved remains. If you found this information helpful, I invite you to share it, subscribe to our channel Wise Old Age, Sexuality and Health, and leave your comments. Remember, wisdom isn't just found in books, it's also in our shared experiences.